Hi everyone, this is Tim, your instructor for the Paramedic to RN transition program. And this will be one of many PowerPoints that I do voiceovers for. I find that this is easier for you to do at home. It also saves a lot of time in class. I also went to Gateway Community College, and I went to school where they basically posted PowerPoints, in the classroom, and we sat there for 3 hours, literally going slide by slide. And I found that was very boring, and I didn't want to go to school. So I find that this is a way for you guys to be able to do this at home and do it wherever you need to, and you're also able to listen to them over and over again, so that way you're able to kind of study a little bit better and easier. So here we go. So the learning objectives for this particular PowerPoint, which is Chapter 1, Introduction to Nursing, the objectives are to describe the historical background of nursing, explain the aims of nursing to facilitate health and the quality of life for our patients. I like to tell a lot of stories, so I'll kind of go as I go through slides. Go through a couple things of my theories or why I do what I do. Um, this is also to describe the various levels of education and preparation in nursing. And we're also going to discuss the effects of nursing and the nursing organizations, especially the American Nursing Association, or even Arizona has a nursing association. And then the last part is going to identify current trends in nursing. So what is nursing? Nursing is an art, the skill application of your knowledge to provide optimal patient outcomes, and it's what you bring to nursing. I still work bedside. I work for Honor Health. I float between Johnson & Lincoln and Osborne, but Osborne was home for about 15 years, and I went from being a phlebotomist to a nursing assistant to an LPN to an RN, and then as far as educating. But I still do work bedside, and I do like it a lot, and it allows me to kind of keep up on my practice and brings in a little bit extra money, and I do it on the weekends, so it doesn't really kind of coincide with anything else that I do here. So for the science, it's the knowledge base of what and why you're doing. I I've told people in the past, the nursing instructors can actually teach anybody how to do a skill. It's following directions, doing what we've told you to do, looking and seeing how things are done, but there is a science behind it. So the idea is not so much for me to stand up here and tell you what to do and how things are done, but it's more of your thinking and your perspective and having the knowledge of why you do what you do. So for historical perspective, early civilizations in the 16th century. The theory of animism, good spirits brought health and evil spirits brought sickness and death. You have to remember that in the 16th century, religion was a very big part of people's lives, and regardless of what their particular beliefs were, it really kind of came down to you do bad things happen to you. You do good things happen. Or if bad things happen to you, you must have done something to irritate either the gods or some sort of higher spirit. But that's how they really believed. So when people actually got sick, they did believe that it was more of something causing it as opposed to germs and infection and things like that. So the roles of the nurse and the physician were separate and distinct. Physician was the medicine man, and the nurse was the caregiver. And that's kind of true today. Physicians, you'll work next to them and they'll, diagnose and prescribe and have some sort of plan of care. And the nurse works alongside them to actually carry out those duties. And it's not a matter of us working, below them or beneath them, but we work as a team to be able to get stuff done. Ancient Greek civilization, they had temples, which became the center of medical care. Nurses care for the sick in the home and in the community, and practice as nurse midwives. You have to remember back then too, women, went into female roles. So whether they were nurses or whether they were like librarians or things that were kind of tend to be more female related is pretty much what they went into. Early Christian period, nursing has formal and more clear defined role. Deaconess made visits to the sick, so again, they were pretty much the caregiver, and back then too, we didn't, you know, nurses were more of the kind of sit at the bedside and kind of, um, you know, do the bed baths and kind of tend to them, but they didn't really practice medicine. They didn't actually have some sort of background as far as, well, this is what we do because of this reason. It was more of, like I said, just kind of mother-child situation. Nursing developed purpose and direction and a leadership. So nurses tended to actually get a little bit, I don't want to say smarter, but they kind of got more of a role and learned how, probably from the physicians, to be able to do certain things. And that kind of evolved the profession a little bit. In the 16th century, it shifted from religious orientation to an emphasis on warfare, exploration, and expansion of knowledge. And this was due to more, wars were still going on between countries. And there was also a lot of death and a lot of dying and a lot of wounded, and the nurses kind of probably got more involved. And it's almost kind of like a MASH, scenario. The out in the field, you tend to learn a lot of hands-on training and on the spot. So I'm assuming that these nurses probably learned a great deal out in the field and probably had the liberty to do a lot more than just be at the bedside and changing bandages and kind of tending to just the sick. I mean, they played a bigger role in that. Nursing had a poor reputation. Nurses received low pay and worked long hours in unfavorable conditions. So, up until probably the 1970s, well, in the 1970s, my mom was a nurse when I was little. I just remember telling me stories that they got paid roughly, $6, $7 an hour. And back then, it wasn't bad money, but it isn't like today. More men are going into nursing, and more people are going into nursing because of the fact that the pay is much better, and we can actually raise families, and we can actually, we're getting compensated for the amount of work that we do. Whereas back then, women weren't getting paid as much because they were women, or because they didn't felt the role was as important as it is today. They just didn't pay them enough. Let's see here. So social reforms changed the roles of nurses and the women in general. So, as time progressed and the evolution of genders, women became stronger and more educated and actually played bigger roles, and really just in anything. Nursing as we know it began, especially with this picture of Florence Nightingale. Um, the Florence Nightingale actually, I want to believe that she kind of really started the whole evidence-based practice movement. She didn't really realize it, but she actually did a lot of keeping of records and a lot of data collecting to find out, what worked, what didn't work. So it wasn't back in the, well, we just always did it because this is how we do it. There was a real reason, and she actually believed that. So she also established the first training school for nurses and wrote books about health care and nursing education. You have to remember that before her, again, most women who were nurses did what they were either told or what they learned from each other. And based on training or who taught you, different things were done different ways. But there was really nothing that was written down or anything that, was logged as far as kind of a general way of doing things and kind of spread throughout the profession. And she kind of really did that. So. Hospital schools organized to provide more easily controlled and less expensive staff for the hospital. Female nurses were under the control of male hospital administrators and physicians. So back in the day, they used to actually have diploma nursing schools where single females would, go into the nursing profession because that was their calling, and they wanted to do something, and the hospitals would actually hire them, but they would hire them with the intent that they would actually kind of live on campus. They would work, whether it be aides or some sort of training and being able to help actual licensed nurses, but it was almost kind of like living on campus. And again, when they needed some help or if you had a schedule, you actually kind of got, went from campus to the actual hospital itself. So so that's how the hospital schools kind of began. World War II, large numbers of women worked outside the home and became more independent and assertive. So, again, women started having more of a voice and more of choices, and actually it went from kind of the Leave It to Beaver mom into, to income household, and actually these women were able to play a big part in providing for a family in the home. Explosion in medicine and technology broadened the roles of nurses. We see that today. You know, I would probably say in the last 20, 30 years, we went from, having landlines and typewriters to computers and handheld, phones. And in fact, your phone is practically a computer in your hands. So technology has really sped up medicine to a point where we just have everything at our fingertips, and that has, you would think, make our job a little bit easier, but then, and it has, we have everything that we need and all the knowledge, and we can Google the crap out of everything, but at the end of the day, the easier that part of the job had gotten, the more they kind of gave us as far as responsibilities and things to do. So it really just has helped us do our job, and probably made us more organized and efficient. But then our role has expanded to be able to do more things too. So growth of nursing as a profession and in discipline. Again, we went from diploma hospitals to being really considered a profession, and we couldn't just stop there. So we really, encourage people, instead of being a diploma and just getting an associate degree, but now they're wanting bachelor's degrees. And my prediction in the next 10 years or so, probably everybody will need a master's degree. And that's not actually a bad thing. We have to continue to evolve in our profession and learning more, and being evolved, because if we don't, then we really kind of get pushed to the sidelines and become more of a, you know, working below somebody as opposed to next to them. And that's the whole point of nursing, is for us to be able to work as a team with doctors and physical therapy and occupational therapy and housekeeping and the aides and administration. I mean, we're part of a team, not just, well, you come in, you clock in, you do your job, and you go home. And because at that point, then they just start telling us what to do, and us losing our voice that we've eventually received. See here, nursing broadened in all areas, the practice in a wide variety of healthcare settings. As a couple slides ago I had mentioned, most women who were nurses were either midwives, or they played that mother-child caregiver role. And as we got more educated and were able to do more things, we actually broadened the profession into several roles. And in fact, Honor Health, the vice president of the board, is actually a nurse. And it's 2017, and that's the way it should be. But 20, 30, 40, 50, 60, 100 years ago, that would have never happened. So we really have come a long way as far as evolving, and the role has broadened into just, instead of just being the bedside nurse, you're being able to go into different fields. We've got the nurse practitioners, we've got nurse specialists. We've got women who, or even men, that are going into the profession and spreading out into different areas like endo and cardiac cath labs and med surg, and it's very interesting how we really are able to do something that we love to do and actually specialize into something, and just kind of create our own path. So nursing, also development of the specific body of knowledge. School in general. I mean, we have block 1 and block 2 and 3 and 4, and then we've created the paramedic to RN program. We have LPNs who are advanced placements. We have nurses who kind of stepped away from the bedside for a couple years, and whether to have kids or whether to just do something else, but then want to come back. And we've got programs that allow them to kind of refresh and go back into the bedside without feeling lost. And these schools, whether it be universities or community colleges, we've really just kind of planned a path and allowed people to come in and do and learn, and actually be able to do better for the profession. See here, conduct and publication of nursing research. Up until probably 20 years ago, maybe even more than that, most nurses did things because that's just the way they've always done it. They were taught by somebody else, and they just kind of passed that information on to somebody else. And now everything is very evidence-based practice, and things that we did years ago, we find out that we really shouldn't have done them, or we actually proved that what we were doing was the correct way to go. And we've become more, are able to publish papers and prove that our profession is really doing some good, and actually doing research and doing things the way we should be doing them, and being able to bring them to hospital boards or administration or managers and say, hey, this is the way we really should be doing it, and actually be able to prove that that was the best way to do it. So See here for nursing, recognition of the role of the nursing in promoting health. Nursing has also evolved into being more of community leaders and actually going out there and trying to, start clinics and having people in the community be able to learn. It's not a matter of just us, fixing and curing and making people better. It's really actually giving them the information that if you stop doing this, this would stop happening. And it wasn't up until probably the last, 10, 15 years that nursing in general has really kind of doing more educating and trying to keep people out of the hospitals by teaching them what not to do, as opposed to just waiting them to, for them to come into the hospital and to treating them. Growth of the nurse as a profession and discipline. So again, we're just evolving every day and getting bigger and bigger and having a voice and being able to make changes and not just nursing, but just the medical field itself, and actually being able to work alongside physicians and administration and aides and really just kind of making a big difference, making an impact. So definitions of nursing. Originated from the Latin word nutrix, which is to nourish. ICN definition is promotion of health and prevention of illness and collaborative care. Again, we're really trying to educate our patients or educate people before they become patients and help, a perfect example, 50, 60, 70 years ago, nurses and doctors smoked at the nurses station. And in fact, doctors smoked while they were assessing patients while they were in the hospital. And, now we're finding out, 50 years later that smoking was not the best thing for people to do. And they end up having, COPD and emphysema and chronic bronchitis and everything else. So, our job is really to prevent people from getting to any point in an infection or any type of chronic illness. So that's why we do, try to teach our patients or people how to prevent illnesses so they can live long and healthy lives. So the ANA definition is a social policy statement. Patient and central focus of all definitions. So again, patient-centered care is really the trend for nursing, or it's the trend now, but it's always should have been that way. But our patient is the center of what we do, and you look at them as a person and as an entity, and figure out holistically every aspect of their life, whether it be physical, emotional, social, spiritual, and you kind of try to tap into all of that and find out where the problems lie or where they need some sort of guidance to be able to, be that, that healthy person and to be able to stay out of the hospital or to be able to prevent any illnesses from happening and to, begin with. So for blended competency, so for you as a nurse or a nursing student, they want to be able to, be able to cognitively think things through. It's not we just do this and this is what I do. It's I'm thinking about what I should be doing, why I'm doing it, the reasons, and what the end goal is going to be. Nursing is also very technical. Everything from charting to, automated blood pressures, machines that we're using every day. I mean, I learn a new piece of technology everywhere I go just based on, everything's always trending and changing and new equipment's coming up and stuff. So, you have to be some sort of a technical person or at least understand how things, work. Interpersonal, we've all gone into nursing or the medical field for some reason. And, I want to believe that everybody who goes into nursing or the medical profession wants to help other people. So that's within you that, drives you to be a caregiver. And then there's always the ethical and legal issues. You'll be faced with ethical and legal decision making every single day. Should I be doing this, and what happens if I do? And this patient wants this, and they have rights, and you just have challenges every day of trying to think things through. And if I do this, what will be the repercussions? Or if I do this, what will the outcome actually be? So, I don't think about it every day or all day long, but it's just something that a lot of times I kind of wonder, okay, well, can they do this or should I be doing this? And it's, sometimes you're just faced with dilemmas you have to think through. So Kesson, competencies. So according to Kesson, I'm to be able to teach you patient-centered care, teamwork and collaboration, quality improvement, safety, evidence-based practice, and informatics. So my job as far as teaching you how to transition from being a paramedic to being an RN, it's to be able to teach you how to care for a patient and again, having patient-centered care, working as a team with your physicians and your aides and the charge nurses administration, and then quality improvement, always working to strive to make the profession better or the quality of care better. Safety, as much as nursing and medicine has evolved, there's always safety issues, and again, we're always evolving to make things better. Evidence-based practices, again, it's not the idea that, well, we just have always done it this way. It's really, why are we doing this, and is this the best way to do it? Here's all the research I've done to prove that this is the way we should be doing it. And informatics is, anything that's technological. The charting system and using computers and machines to be able to help you do your job better and more efficiently. Interrelated rules, you as a person and as a nurse, you're going to be a communicator, you're going to be a teacher, you're going to be a counselor and a leader and a researcher and an advocate and a collaborator. I mean, these are, you aren't just a nurse, you're a lot of different roles to a lot of different people, and it just makes you very well-rounded, and being that go-to person, or that person who's able to problem solve and be able to help as many people as you can within some sort of either role or as a team. You're just kind of pulled in different directions, but that's a good thing. You're the person to go to and be able to solve problems. So I think that's a cool thing. So other things that affect health in your patient is genetic inheritance, cognitive abilities, whether or not your patient is learn-oriented or if they're able to actually understand what you're telling them, their educational level. I did my master's capstone on health literacy, and it's very interesting how we are expected to be educated. You start talking or thinking a certain way, but then your patient necessarily can actually understand you or can follow your train of thought. And it's very interesting that you could be talking to someone who has a PhD and they can completely get it, or you could be talking to somebody who has less than a high school education and they don't, or vice versa. So my capstone was really based on the idea that you find out the learning of your patient and you gear your education towards them. So whether they're auditory or verbal or visionary learners, you kind of learn how they are able to understand and comprehend what you're telling them, and you kind of pattern your education or your education towards them in that direction. Other factors are race and ethnicity. Not everybody was raised and grew up and was, is from either this area or even, Arizona. I mean, everybody's from somewhere else, and we've all learned, and we've all came from a culture of how we believe or what we do, and just live life. So, and it's not just being, black or white or, Native American or Hispanic. It's all about being a culture and where you came from and how you think and what you believe in. You have to, as a nurse, understand that and be able to, come across as someone who can respect who they are, but kind of be able to change their thought process. You can't take a certain culture who has a disease or an illness that is cultural and try to completely change it. You have to be able to educate them in a way that they understand that it's not, the correct way to go, and kind of make it, it's something that's palatable and maybe understand and be able to want to change that style. Age and genders are factors, developmental level, lifestyle and environment, and socioeconomic status. Not everybody can afford medications, and not everybody can afford to go to the hospital, and not everybody believes that, well, if I can't afford it, they'll just eat the cost. I mean, there are a lot of people who either don't go to clinics or hospitals or seek medical care because of they just feel that they can't afford it, and they'll just kind of, I mean, I grew up in a small town, Ohio, and had grandparents that unless you were dying, you still went out in the field and you still tended to the farm, and they passed away in their 80s and in the 90s, but they just didn't not feel good and go seek help. They really just kind of lived with symptoms until it either killed them or they went away. So the aim of nursing is to promote health, prevent illness, restore health, and facilitate coping with a disability or death. So, again, I've mentioned this before in the other slides. The goal is to actually try to educate our patients and prevent them from being ill. But when it's too late or they do get ill for whatever reason, our goal is to actually make them better. And then if they can't completely get better, for us to be able to help them understand and how to cope with the fact that they may become disabled, or that, and I've consoled people all the time that have had loved ones die, and I'm not insensitive, but to me, death is a process of life, and you kind of get used to it, and you understand how this really works and how this affects people, and you're there to help, you know, um, give people the ability to, cope with those things. So healthy people in 2020 health promotion guidelines. So attain high quality, longer lives free of preventable disease, disability, injury, and premature death. So again, we're not really just waiting for people to come to us and say, "Oh, I'm sick, and can you help me?" It's for us to be out in the community and really try to educate people on how to prevent and getting sick, and preventing death and disability and injury and everything else. So our also goal is to achieve healthy equity, eliminate disparities, and improve the health of all groups. So it's not just people you come in contact, but it's actually going out in the community, going out there and really affecting as many people as you possibly can, and improving um, their health, and again, you're really going to cultures and specific areas and religions. I mean, it's just you're trying to come into contact with as many people as you possibly can to make life better. One of the other guidelines is promote quality of life, healthy development, and healthy behaviors across all life stages. So you're not just taking care of the 20-year-olds or the 30-year-olds, but you're really taking care of everyone from, babies to the elderly who are in their 90s. And I've taken care of people who are 100 and 105, 110, and they've lived as long and healthy as they possibly could. And, everybody gets sick. And again, eventually the body does, tire out. So. But you do what you can to be able to keep people well, or at least take care of them. Nursing is a profession and a discipline, well-defined body of specific and unique knowledge. Again, we actually have guidelines of what we teach you in certain blocks, or what we are to teach you and test you, and to make you ready for the world when you graduate. Strong service orientation, recognized authority by a professional group, code of ethics, professional organization that sets standards, and ongoing research and autonomy of self-regulation. Educational preparation for nursing practice. So we have practical and vocational nursing education, registered nursing education, which is diploma, associate degree, and bachelorette or baccalaureate in nursing. Graduate of education in nursing, and continuing education in service education. So the worst thing or the best advice I could possibly give you is that when you do graduate, that you continue getting on your education. It doesn't necessarily have to be a bachelor's or master's or a PhD. It's more of just constantly learning new things, and whether that's going to a class, whether it's reading an article, whether it's learning from your coworkers, never stop just learning, and to really just kind of keep evolving the profession and changing things for the better, because if not, we become stagnant. And again, if we don't continuously evolve, then we kind of get pushed to the sidelines, and we've come too far for that to happen. Professional nursing organizations. So we have the AANA, which is the American Nursing Association. We have the National League of Nursing, the AACN, and we have the NSNA, which I believe is the National Student Nursing Association. So again, these organizations are good. They've taken leaders within the profession, and it could be anybody. You don't have to actually have a specific background or a certain degree. It's anybody who is a nurse that wants to make change, and they form these groups to be able to go to, whether it be Congress or Washington or even the state level, and trying to make changes as as that are needed. We need a voice, and that's what we do as a profession: is come together and pick someone to speak for us. So guidelines for nursing practice, we have nurse practice acts and licensure, and we have the nursing process. The nursing process we're going to go over in class, and excuse me, that's going to be a whole new way of you to think, and I'm actually kind of excited to actually teach that process. And once you get the hang of it, you actually like it. The nurse practice acts and licensure, that's all based on the Arizona State Board of Nursing. And, in the previous slides, again, we have groups for people, we have groups to be able to be a voice for us and to go to the state boards and go to state level of Congress and to Washington and to make, like, and, be advocates for us in our profession to make changes for the better or to actually change things that have always been there. And again, research has always come out with new things. We just need somebody to, bring that to the front and be able for other people to be able to see and hear our voice. Nurse Practice Acts define the legal scope of nursing practice, create a state board of nursing to make and enforce rules and regulations. Some states require continuing education units annually. So Arizona is actually one of the few states that do not require continuing education after you receive your license. My theory is that there is a physician in Tucson who has been pushing for the last probably 15 years that I've been a nurse, for us to have continuing education. And I think because of that, the board kind of does it out of spite that because he's a physician and requiring us to do it, they're kind of pushing back and saying, no, we won't. But the continuing education is really, again, it's the belief that when you graduate, you're constantly learning something new. You're still reading articles and research and reading books and trying to make a change or make sure that the care that you're giving is the latest and the greatest and the best way to actually do it. And the continuing education is the belief that, if the state board says that yes, you need a certain amount of credit or units every couple years to renew your license, that you'll continuously learn something new. And it's almost kind of a forced suggestion. But again, Arizona does not make you do that. So every couple years when your license is renewed, write them a check and send it off and you renew your license. So but I believe that continuing education units, again, it kind of reminds people that we really should be learning and making sure that we're keeping up to date as far as how we should be doing things. Nursing Practice Acts also define important terms and activities in nursing, including legal requirements and titles for RNs and LPNs. So again, I was an LPN before I was an RN, and there's some things that they can do and some things that they can't with an RN or having somebody oversee them. Again, we work as a team, so I never really felt as if I actually worked below them or I was less than. But there's just certain things that RNs can do because of more training. And the Nurse Practice Acts and the State Board of Nursing actually defines what those are. The Nurse Practice Acts also establish criteria for education and licensure of nurses. So even though you're going through a paramedic to an RN transition program, I have to follow guidelines. You have to have a certain amount of clinical hours, you have to have a certain amount of lecture hours, you have to have a certain amount of lab hours, and the board dictates what and how I teach you. I can teach you any way I want, but I still have to include a certain criteria as far as what you need to know in order to go into block 2 or 3 or 4. So again, I brought up the nursing process, which we'll learn in class, and we'll go into bigger depth. And again, I think once I teach you simple ways on how to do it and change your, I don't want you ever to think, oh, well, I have to stop thinking like a paramedic and think like a nurse. I just want you to be able to shift your way of actually retaining, reading, and absorbing information from being a paramedic to thinking differently and absorbing and reading and studying more the way a nurse would think. But the nursing process is one of the major guidelines for nursing practice, and it helps nurses implement their roles, integrates art and science of nursing, and allows nurses to use critical thinking and clinical reasoning, and defines the areas of care that are within the domain of nursing. So the nursing process is what we, is an acronym called ADPI. So basically, you're going to assess your patient. You're going to come up with some sort of nursing diagnosis, which we'll go over more in depth in class. But the nursing diagnosis is what is the problem. If you go into a room and you ask your patient, how are you feeling? They say, well, I'm having some pain. The nursing diagnosis or what you see is the actual pain, or what they've told you is the pain. you're then going to actually come up with a plan. What should I do? Should I do a heating pad? Should I do some ice packs? Should I give them some pain medication? Should it be oral pain medication? Should it be IV pain medication? You come up with a plan how to actually fix their pain. You're going to then implement what you decide to do. So let's say I give my patient 2 Percocet to control their pain. That's my intervention. That's me intervening and actually trying to control their pain to fix the problem that they have. Once I actually give it to them, I know that Percocet takes about 20 minutes, 30 minutes to work. I then evaluate whether I have done my job into getting rid of their pain. And if it worked, then I have done my job as a nurse and I have followed a nursing process. So it's assess, see a problem, diagnose it, come up with reasons and what you can do to fix it, and then evaluate whether or not they worked. I've done things that have not worked, and you need a plan B and a plan C and a plan D, and I've done things that have worked right away, and that was done. So, but again, we'll go over this in class. And like I said, once I actually kind of explain it and give you some tips and tricks and stuff, you'll get it, and you'll study and you'll absorb the information a little bit better. And again, this is also the way I think. So the more you realize and understand and figure out how I think, the better off you are as far as, again, reading and studying and listening and testing. So, National League of Nursing, 10 trends to watch for in nursing education. So changing demographics and increasing diversity. It's 2017 and everything seems to be going to online. And I got my bachelor's degree from Grand Canyon. I actually went to a class every Wednesday evening and did that for a year and a half. Then I did my master's degree and I actually did it completely online and met no one that I actually went to class with. So, but that's the trend. Millennials and anybody who can actually work on a computer, they're finding that's easier, more efficient, and you're able to get a much broader group of people. So that's a trend. Technological explosion. Again, the computer and all the software and all the technology that we have at our fingertips is making our job easier, more efficient. But again, it's allowing us to do more things. So the era of the educated consumer, alternative therapies, and genomic and palliative care. The shift to population-based care and the increasing complexity of patient care. My theory is that in the next 10 or 15 years, nursing will be moving not so much as far as away from the bedside at the hospital, but moving out more into the community and really trying to reach groups of people to prevent illnesses. And the more we can prevent, the less likely they are to come to the actual hospital seeking care. Once we start doing that, it will be less people in the hospital and more people going to clinics to actually seek very acute, minor issues to be fixed. And again, if we can actually educate them and prevent them from happening, then we really are doing a job in the sense of keeping people healthy and living longer, and again, not really needing care per se in the long run. The cost of healthcare and the challenges of managed care. You know, I don't say this to be flippant, but I go to work, I get paid by the hour, I do my job at the hospital, and I care for everyone, and I give them good quality, competent care, regardless of them having insurance, whether or not they're paying the bill. I'm there to serve them and make them better. But healthcare is very expensive, whether you believe in the Affordable Care Act or not. Hospitals who do not get paid cannot pay employees, and when money runs out, staffing gets very tight, and they have to be able to keep the lights on and pay the electric bill. So managed care and hospitals and even the government are trying to do what they can to make things better. And again, this is not a matter of whether or not you believe the trend of government, but it's the idea that we can't just continuously raise prices and expect people to pay when they have no money. And if they don't have anything, then we don't get paid for anything. So The impact of health policy and regulation, the growing need for interdisciplinary education and collaborative practice, the current nursing shortage, opportunities for lifelong learning and workforce development. So again, you didn't go into this profession to be able to do it for 5 or 10 years and then decide to go do something else. You're going into this profession with the intent that you will become a nurse, work at the bedside. We have the freedom to be able to go in any direction we want to in medicine as a nurse and to be able to learn new things. The last 15 years, again, prior to me being a nurse, I went from being an aide and a phlebotomist to an LPN, and I've been in administrative roles. I've been in supervisor roles. I've went back to the bedside. I mean, I'm able to do whatever I want when I want to do it and still stay within the nursing profession and helping people. Another trend would be significant advances in nursing science and research. So again, the more research we do, the more we learn, the more we can actually change things for the better and improve that we're doing what we're supposed to be doing and evolving. National supply and demand projections for registered nurses from 2000 to 2020. So again, as the um, baby boomers are getting older, they're living longer, and the nursing shortage is becoming greater because you want to go into this profession to do this for the rest of your life, but you can only do this for so long until your back hurts, your knees hurt, and the 12-hour days are too long, and we start going into different roles and doing different things based on shorter days or easier workload or just be able to, again, be able to do what you want where you want to do it. And one of those things is retiring. And, I like to retire when I'm 50, but that's not going to happen. So I will work in probably until the day I die. But the baby boomers are living to be 80 and 90 years old. So the more nurses we have that retire or shift away from the bedside into other roles, the more shortage that we're going to actually have. So someone still has to take care of those 80 and 90-year-olds. So. And that's the end. So thank you for listening to your very first voiceover, and hopefully I wasn't too boring. And again, I kind of ran through a little quickly, but the idea is for you to be able to get the idea and the gist of what each slide really contains. And when you do have questions, bring them to class. And also, my idea is to be able to do the PowerPoints, which kind of coincides with some sort of chapter in the book. Now, this PowerPoint came from Block 1, which I'm integrating several things from Block 1 into your program so that way you're able to learn. So anyways, if you have any questions, bring them to class.